With more than 20 years working with rural, remote and Aboriginal communities, the Healthy Communities Foundation Australia is embarking on an ambitious new journey to achieve its vision of health for all. What this means for us is that every child can get the best possible start in life. Everyone can access high-quality primary care and social services. Young people have the knowledge and skills they need to prosper. People with particular needs get the support to live full and productive lives. And everyone, no matter their race, age, sexuality, gender identity, or other characteristic, is given a fair go.
We aim to transform the way healthcare and community services are delivered, in partnership with communities, by advocating for policy change and mobilizing resources to target diseases of disadvantage and achieve equitable access to healthcare. Our objectives over the coming 5 years aim to help us and our communities to achieve progress in our vision of health for all. First, we will work with disadvantaged communities to help them to create places and contexts in which people can be healthy and thrive. Second, we will foster ethical, equitable, innovative, integrated and collaborative health and community care solutions using new approaches and technology to improve outcomes for disadvantaged communities. Third, we will build research and policy alliances to explore and promote best practice in building healthy and prosperous disadvantaged communities. Fourth, we will advocate with disadvantaged communities for health, social, economic and environmental equity.
And fifth, we will continuously improve our financial sustainability, effectively manage risk, measure impact and become an innovation leader in employment flexibility, while minimizing our environmental footprint to ensure that we can continue to serve disadvantaged communities and the planet on which we live. To achieve everything we want for rural, remote and Aboriginal people, we need to be an organization driven by a set of common values and behaviors.
We are committed to listening and caring, acting with integrity, supporting diversity, being agile and innovative, working together collaboratively, and being courageous and doing what is right.
The principles underpinning everything we do are designed to ensure that our programs and initiatives reflect the needs of our communities. We work to support you and your community on your journey, and we will provide you with advice to help you to get to where you want to go. We call this way of working with you community-led development. Essentially, your community leads and we assist you.
We are committed to the human rights of all people. We celebrate diversity, promote inclusion, and encourage participation of individuals and the community in all aspects of their health and well-being. We understand that every community is different, so we treat each as unique and work together to address their specific needs. We respect the community as experts and active participants in development and the implementation of programs.
We focus on the strengths of a community and its people, including personal strengths and social and community networks. We do not focus on deficits. Strengths-based practice is holistic and multidisciplinary, allowing us to work with individuals and communities to promote equity and opportunity.
Our advocacy and professional practice is grounded in the evidence of how communities can improve their health and well-being, and we pride ourselves on being an informed and reliable source of best practice.
Our theory of change describes how changes in health outcomes for rural, remote and Aboriginal people are expected to happen. Underpinning our theory of change is building the health literacy of our communities so that they have the information and tools to make good decisions about their health and how to navigate the complexity of the health system. To achieve this, communities need to be front and center in all our programs, helping us to understand their needs and goals and the ways in which the community plans and makes decisions.
For healthcare to be truly universal, it requires a shift from health systems designed around diseases and health institutions towards health systems designed for people. That is why we focus on service delivery through an integrated and people-centered lens, particularly for reaching underserved and marginalized populations to ensure that no one is left behind. Integrated people-centered health services are services where all people have equal access to quality health services that are co-produced with communities and meet the needs of people over the course of their whole life. Our goal is to design services that are coordinated across the health and social service areas to enable people to access comprehensive, safe, effective, timely, efficient, and acceptable care in a local supportive environment. The Foundation's Community Development for Health framework begins by asking the community about their priorities, and then working with communities to build realistic and achievable strategies that identify what can be done locally, and where help from government and others may be needed. The Healthy Communities Foundation Australia is the only rural and remote health charity headquartered in a remote community. We live and work with rural and remote people every day, building community capacity, creating jobs and delivering better health outcomes for all.